Welcome to the Tech Blog Writer Podcast, your guide to future tech trends and innovation in a language you understand. Now, over to your host, Neil Hughes.
Welcome back to the Tech Blog Writer Podcast, where every day I look at how technology is transforming an entirely different industry. Today, I want to turn my attention to healthcare, and let's face it, healthcare is a topic that will affect each and every one of us and our families. But I'm noticing a big shift in healthcare right now, and technology is right at the heart of it. For example, traditionally, we've had a reactive healthcare system, which means we wait until we get that nasty rash, lump or cough, and then react to it by seeking help and booking an appointment with our local doctor. But healthcare is now heading to a much more proactive state. For example, the watch on our wrist can monitor our exercise, sleep and heart rate, and we can even use our smartphone to track every single calorie that we consume. But a company called Snap40 is taking things a step further. Snap40 is an AI-enabled healthcare company with the mission to protect the health of every human being. Essentially, Snap40 monitors the human body in real time using a wearable device with accuracy that's the equivalent to ICU monitoring. And using that real-time data, the company's proprietary algorithms can identify those whose health is at risk and proactively bring healthcare to them. It's a fantastic story. I've probably revealed too much already, and I hope you enjoy this one as much as I did. So buckle up, hold on tight, as I beam your ears all the way to Scotland so we can speak with Christopher McCann from Snap40. So a massive warm welcome to the show. Can you tell the listeners a little about who you are and what you do?
Absolutely. Thank you for having me. My name is Chris McCann. I'm the CEO and co-founder of an Edinburgh-based tech startup, Snap40. My background's fairly different in that I did a computer science degree, then decided I didn't want to do software engineering full-time, so went to medical school, and then dropped out of medical school to build this company. We focus on trying to keep patients continuously connected to their healthcare team, be they at home, be they in the hospital. We continuously monitor them from their upper arm from a little wearable device that monitors them across everything from their blood pressure to their oxygen saturation, and then we use all of that information to try and identify the one single patient who is at risk or is starting to deteriorate, so that healthcare can intervene earlier, save their life, reduce their time spent in hospital, stop them going back into hospital.
When I first started reading about you guys, quickly learned that Snap40 is an AI-enabled healthcare company with a mission to protect the health of every human being out there, which immediately sounds incredibly ambitious. Now, you did mention about the wearables and the kind of people that would have them there and the kind of protection, but can you just tell me a little bit more about what Snap40 is and the kind of problems that you're solving?
Sure. So, in a typical hospital, let's say 9 Miles, where I was training as a medical student, they've got a 10-bed intensive care unit where the patients are all continuously monitored, and they've got, a nurse at the end of every bed. Most patients in hospital don't have that kind of intensity of monitoring. Most, they have their vital signs checked every 4 or 8 hours. And once the patient leaves the hospital and goes home, effectively, we have no idea what goes on with them at all. There's no monitoring of them whatsoever. And the reality is that leads to us recognizing health problems later than we would ideally like, which means that the patient's outcomes can be poorer, but also means that we put more strain on the health services. We have more people turning up at the emergency department, more people staying in hospital for longer than is maybe necessary. So what we wanted to do was try and monitor all of these patients who wouldn't otherwise be monitored. But, that is a huge number of human beings to monitor. And all you then do is create a huge amount of information. And, artificial intelligence has become this really annoying buzzword, and most of the time I avoid using it, but where AI is really, really powerful is scaling the efforts of a single human being, allowing a human being to do more than they could with their own mind. And one of those jobs is looking across loads and loads and loads and loads of bits of data and identifying the signal within it. And that's what we're trying to do with real human beings, because we don't have enough physicians to monitor tens of thousands of patients. If we can use AI and computation to do that, we can tell the physician, the nurse, this is the patient you need to be interested in, and that's what we do.
I love how you're actually monitoring the human body in real time using this wearable device, which has the accuracy equivalent to ICU monitoring, which is a fantastic thing. But can you tell me a little bit more about the tech behind it and how it works?
Yeah, of course. So neither Stuart nor I, Stuart's my co-founder, neither of us are hardware engineers. Neither of us had any background in electronics. But one of the things we recognized early on was that without some real-time data from the patient, you can't really understand if they're starting to deteriorate or if problems are starting to go wrong. You can't really understand a patient's baseline if you don't have real-time data from them. And we were not impressed with the existing array of monitoring devices that were out there. So we felt, well, let's build our own. But what makes us entirely different to anyone else is that our wearable that sits on the upper arm of the patient, it's packed full of different sensors, but we then transmit all of the raw underlying waveforms from that device back to our cloud platform, and we can then use that platform to analyze those signals to turn them into vital signs accurately. That's how we achieve ICU accuracy. And then we can start to use them to look for patterns that indicate deterioration is coming, because doing the computation in hardware on the device itself is really expensive in terms of battery, in terms of the need to reduce size. But doing it in the cloud is computationally inexpensive. So it just made sense for us to do that. Another, or to be honest, even bigger part of our focus, though, is on user experience, because the patients who most benefit from this are not 20, 30, 35-year-olds who are used to iPhones and consumer tech. These are 80-year-olds with multiple chronic diseases who don't own smartphones, who are digitally left behind, if you like. And one of our jobs to make this successful is how do we deliver a user experience that is phenomenal for them, that they're willing to engage with it, because otherwise you're depriving the population who needs it most of the ability to actually access this technology.
So are there any examples that you can provide of how you can catch a deteriorating health situation sooner by automatically identifying those warning signs and ultimately providing targeted early alerts to allow physicians to intervene earlier? Is there any examples that help people visualise exactly how it can help?
Yeah, so we do this in two different ways. The first one, which is where we're at today, is we allow the physician or the nurse to set really powerful and complex rules based on what we've learned from the data. So they can say, based on a specific patient's baseline, to look for changes across one or more vital signs. And we've already seen patients who, this is a very simplistic example, but one patient started to become very profoundly bradycardic, which is when you have a low heart rate, and the hospital in that case were able to intervene in the patient's own home and stop that patient being admitted to hospital. And that's a very simple case. What we are then doing, and this is really the next stage of our development, is using all of this data that we are gathering on patients to start training machine learning models to spot patterns themselves. So things that the human eye might not see, or that require the human eye, or would require the human eye to look across, vast amounts of data. So we're using all of that information to build predictive models that can say, based on the patterns we've seen across thousands of patients before, we think this eventuality is going to happen. And that's really a work in progress and what we're now focusing on.
What I also love is that presumably the information captured by the device enables real-time data and how your proprietary algorithms identify those whose health is at risk and proactively bring healthcare to them. Because for so long, healthcare has been very reactive, so proactive healthcare is a huge step forward. But can you tell me a little bit more about that too?
Yeah, I mean, that was one of the real inspirations for the company. And part of the challenge is that, for me, this is where technology really comes in. Technology is not about automating physicians. It's not about automating nurses. It's about helping physicians and nurses to do what they do best, which actually is deliver proactive care. But they need to know which patients are at highest risk. They need to know who they should be targeting that care to, particularly given how strained healthcare services are going to become. 40 years ago, the average life expectancy was something like 48 years old. Now it's 70. So we've got a much older population who are much more likely to experience chronic diseases. And therefore, it's really, really hard for physicians, nurses, other healthcare professionals to prioritise and know who they need to care for, which means it inevitably becomes reactive. But if we, for example, can prioritise for them the 1% of patients who need their time and need their focus, then I think we can help them to flip the healthcare model round from the reactive position to the proactive position.
Now, I'm always fascinated by every guest that comes on this show about the story behind their journey and what made them want to go out there and create their solution. So when I recently read how, as a medical student, I think it was, you witnessed patients live with a long-term disability or even die as a result of late recognition of their deteriorating health. So if I could I take you back in time to that moment that inspired you to actually go out and create Snap40 and bring it forward? What was the story behind that?
I think it was two separate things. So you're absolutely right. The first one is being a med student, and healthcare is full of kind of obvious problems, and I specifically mean things like operational and workflow problems. There are so many places where, from handwriting prescriptions to manually writing notes to things like that, it takes considerable time to do certain healthcare tasks. As a result of that, that's another reason why you see this kind of reactive nature of healthcare at the moment. So coming from a computer science background, it kind of astounded me that I could order something on Amazon and get it in an hour, but it can take 10 minutes for every drug that a physician wants to prescribe just to write it up and get it there. That just seems crazy. Yeah. So I thought, well, surely we should be able to do something different, and specifically seeing several patients who lost their lives as a result of late recognition of warning signs. I thought, let's go and do that. But at the same time as that, I had my grandmother was particularly unwell. She had vascular dementia and COPD and heart failure, and not unlike a number of 80-year-old ladies in this day and age. But again, the care for her was really reactive. We waited until she was so unwell, she was having to be placed in some kind of acute care, as in taken to the emergency room, admitted to hospital, which is a really traumatic and tragic experience for anyone of that age. And it again struck me that if we had got advanced warning something was going wrong there, maybe we could just have intervened at home and stopped that whole thing happening. And that would just be so dramatically better for her personally, for the family, and again, take the strain off the health services.
So when you first had this idea to use technology to make a difference and improve healthcare and ultimately save lives, what have been your biggest challenges that you've had to overcome?
So most companies in the healthcare space or healthcare technology or medical device space are still university or academic spin-outs, which means they get a period of time that's relatively safe with access to money to build out their idea before it's taken out. We had nothing, we literally had nothing at all other than an idea. And that idea required significant capital, significant support from healthcare services to get to fruition. So I think the first and biggest challenge was, how are we actually going to build this with no money and no support at all? And in reality, we went out and begged, borrowed and stole everything we could in order to put together enough to build a prototype. We were exceptionally well supported by some of the Scottish government agencies and things like Scottish Edge up in Scotland, who do amazing work with early stage companies with ideas. And we managed to convince an NHS health board to support us at an exceptionally early stage with a clinical study of it. And really that was what gave us enough to move forward and raise our first big round of money. But it was, we had to be incredibly scrappy in order to get to that point, because we were building from nothing at all in a incredibly challenging space.
So you've recently announced an $8 million funding round and also growing your New York office. So how is that funding going to help you take things to the next level and make that difference that you set out to achieve?
Yeah, so our focus with this round is continuing to grow our product team. We are really proud that we have managed to bring some of the smartest engineers and data scientists and biomedical engineers anywhere in the world to work with us. And we've had people coming to us from so many different countries to try and solve this problem with us. So we're going to keep growing that and keep working on making our product amazing for healthcare providers, for professionals, for the patients themselves. And then we're also focusing on starting to really push on getting the product out there, both in the United States, hence the growing office in New York, and in the UK. Our focus at the moment is let's get it out on patients. Let's show that this can deliver clinical and economic benefits, and that'll then help us scale.
So a few moments ago, you did mention how when you was a med student there, and the difference that you wanted to make, having been surrounded by problems. So if we do have anyone listening with their own idea on how to make a difference with a tech solution in any industry, what kind of advice would you give and pass down to them?
Firstly, don't assume that anyone has done your idea better or that there's already someone out there who solved it. There likely are people with your idea, but healthcare is full of so many opportunities to come in and solve amazing problems that solve or that change people's lives, and where you can build a really big company. And the second is building a company, in my opinion, is just an exercise, or a huge exercise in learning. So don't be intimidated because you're entering a space that you know nothing about. We knew nothing about medical devices. We knew nothing about building a medical company, knew almost nothing about building a company at all. But if you open your mind and you surround yourself with amazing mentors and you listen and you keep pushing hard, you can do it in a space that you know nothing about. And we need more people to do that, because healthcare, it's the space that needs us most. It's going to be the biggest challenge, or one of the biggest challenges our society faces. So I hope more people will go into the space, but they need to be open-minded to learning, and be resilient to the hundreds of challenges you'll face.
So as we look towards the future then, are there any big goals that you're going to be chasing over the next 12 to 18 months, or anything else that you can share with us today?
Yeah, we're continuing to significantly grow our team, so we should be 45 to 50 people by the middle of next year. Still mainly investing in engineering, data science. We're always looking out for amazing people to join our team, no matter their skill set. So we'd love to hear from people who want to join us and solve this problem. And then our second major goal is getting it on to patients with a small number of early adopter healthcare providers who we can work really closely with to continue building out the product, to show the benefits before we start really scaling this in 12 months' time. We are incredibly ambitious as a company. We already see a future where everyone is wearing something that tracks their health, and that healthcare comes to them before they even know they need it. And we fully intend to be the company that delivers on that. So, the world is our oyster.
So if we do have anyone listening today that's really interested in everything that we've talked about, what's the best way that they can find you online, or even contact a member of your team if they have any questions after listening to our conversation?
Yeah, so you can find us at snap40.com, and to be honest, feel free to shoot me an email directly. I'm on Christopher@snap40.com. We'd love to hear from anyone that's interested in what we're doing.
Well, at the end of every episode, I always say technology works best when it brings people together, but you've taken this to a whole new level. I mean, what you're doing with technology is actually going to save lives, which is a fantastic thing. So more than anything, though, just a big thank you for coming on today and sharing that story, and I wish you the best for the future. And let's get you on in 6 months, see how that journey's going.
Thanks, Neil. I really appreciate your time and the opportunity.
Once again, the biggest inspiration from today's episode is how Christopher was a medical student that witnessed patients living with those long-term disabilities or even lose their life as a result of late recognition of their deteriorating health. And he was also surrounded by inefficiencies. And yet in his personal life, he could get things from Amazon delivered to his home or office within an hour. Something clearly wasn't right. Did he complain? No, he did something about it. And that's what makes this story all the more special. Sure, it highlights the power of technology, but maybe it's because I was raised on a diet of Knight Rider. It really does prove that one man can make a difference. Or to bring that pop culture reference up to date, one person can make a difference. And each and every one of us really can make a difference. And that smartphone that sits inside our pocket, or dominates most of our time, is capable of so much more than just scrolling down an Instagram or Facebook feed. Such a fantastic story, but over to you. What were your thoughts? What did you take away from today's episode? And is there anything you'd like to add to today's conversation? You can email me, techblogwriter@outlook.com, tweet me at Neil C. Hughes, or drop by my website, techblogwriter.co.uk. Now, I'm also taking part in a pilot for LinkedIn called LinkedIn Series, and I'm going to be sharing many of the stories that I feature on this show in a written series of how technology is making a difference and how businesses are tackling the digital transformation. So look me up on LinkedIn if you're not connected already. You'll be able to find me under Neil C. Hughes. Look for the digital transformation stories and just hit subscribe if you'd like to keep up to speed. Just don't ask me what the C stands for. And on that subject, it's time for a sharp exit. So a big thank you for spending a bit of time with me today. And I'll speak into your ears again tomorrow. So a big thank you for listening. And until next time, don't be a stranger.
Thanks for listening to the Tech Blog Writer Podcast. Until next time, remember, technology is best when it brings people together.